Wonderful. Rep. Amabile, are you ready to go?
I'm ready.
Thank you so much. Thanks for being here.
Yeah, thank you. That will teach me to be late because now I have to go after Kyle Brown, and I do not have a slideshow. And I just ran in from getting back from Denver. So anyway, I appreciate the opportunity to be here and all the work you guys do for all of us. And I'll start with that. And then I understand I'm supposed to focus on healthcare. And so I think you all know that my particular focus on healthcare is around behavioral health. And so I can talk a little bit about the things I've been working on this session and maybe put them into some buckets because they're not exactly behavioral health, but some of the things are also about the social determinants of health. So I have several bills that are about the intersection of criminal justice and mental health. And I'm on an interim committee where we talk about that. It's called the treatment of persons with behavioral health disorders in the criminal and juvenile justice system. So the first one has to do with what happens to juveniles who are deemed to be incompetent to proceed. And I think most people had no idea what it meant to be incompetent to proceed, but now we all know a little bit more about that than we ever wanted to know because the King Soopers shooter hasn't gone to trial because he's not competent to proceed. And it means that he can't assist in his own defense. And, you know, this happens with kids also. And we wanted to make sure that we were making that process as fair and as helpful to our juveniles as we could, so that they can get put on a path to recovery instead of being overly punished in such a way that they might not ever recover. So that bill has made it through the House and it's in the Senate right now. There's also another bill from that same committee, and that is about what happens with adults who are found incompetent to proceed. And it wouldn't affect somebody like the King Soopers shooter, but for people who have committed lower level crimes, it provides a pathway for them to go from jail where they're waiting for a bed at the state hospital. It gives them a pathway to go to an involuntary commitment and have their charges dropped. And it's mostly for misdemeanor crimes, so that instead of being in jail, you're now in a hospital setting where you actually have a chance of recovery. And so that bill is sitting in appropriations right now, and hope it's been through the committee in the House and hopefully will move next week. And then in that same vein, I have a bill that is about what happens to pregnant women who are in the criminal justice system. And it is allowing alternative sentencing for pregnant and postpartum women so that women can be with parents, can be with their baby when they are, deliver and into the first year, so that we don't create separation trauma for this baby and create generational trauma that will potentially result in a person who isn't coping well with being in society, and also give the parents sort of a life worth living so that they feel like they can bond with their child and those kinds of things. And that bill is in committee tomorrow in the House, but it has already made it through the Senate. There's also, that bill is now in the Senate. There's another bill that is about kids whose parents are incarcerated and making it easier for the kids to visit their parents and to spend time with their parents and to have a meaningful relationship with their parent who's incarcerated. And this is the bill that's up in committee tomorrow. And it also says that you can't use the fact that the parent is incarcerated as a reason to terminate their parental rights. And that we're doing that because it's not good for kids. It isn't in the long run good for them to feel like their parents abandoned them. So it allows the parent to be in the courtroom when decisions are being made about what's happening with their child. And it makes it easier for the child to spend time with their parent. So that's kind of one category of behavioral health. Then there's two other bills that are about how do we make it so that people are ready when they get out of being incarcerated. So one of them is providing free phone calls for people who are in the Department of Corrections in prison. And there's a lot of data that suggests that people who can connect with their family on a regular basis have a much lower recidivism rate because they have somebody to go to when they get out. And also their family is still connected to them. So it's, again, a winner for the kids. It's a winner for the family. And it will, I believe, save us money in the long run, even though in the short run, right now, they're having to pay for these calls and it's very expensive. So there's a lot of people who just don't make any phone calls and they get really disconnected from their families while they're incarcerated. And then the other one, which also came out of this same committee about the treatment of people with behavioral health disorders, and that is about the use of these 4-point restraints. So right now in DOC, people with serious and persistent mental illness are literally strapped to a bed on their back. And they have their hands and feet chained to the bed with metal restraints. And disability law went in and audited all the paperwork around that and found that people are being left there, some people for up to 35 days strapped to a bed. And they do let them up to use the bathroom and to eat, but then they make them go back down on this bed. So we want to put some meaningful guardrails around that. It is tantamount to torture, and it doesn't help somebody with a serious behavioral health disorder. It doesn't help them get better. It really makes them worse. And we had somebody who was in that situation who spent a couple of weeks on a restraint bed come and testify in our committee. And it's just heartbreaking, just incredibly, you can't believe that's what we're doing here in America. But we are on a pretty regular basis. So then the other sort of category of behavioral health bill has to do with, well, one of them is, it's a cleanup bill for the Behavioral Health Administration. And so last year we set up this brand new governmental entity called the Behavioral Health Administration. And the head of the Behavioral Health Administration is a cabinet level appointee who is part of the governor's cabinet. And this organization is charged with really revamping our entire behavioral health system. And there's been some problems actually with the implementation as it's gone along so far. And a lot of people are really wondering whether we got it right, including me. So the cleanup bill is mostly technical cleanup stuff, but we are also trying to put some guardrails into that bill to make sure that there's accountability for the BHA, which is a multi-million-dollar agency with lots of employees. And we want to make sure that they're actually doing what we want them to do and that we're spending our resources wisely. And so that bill has made it through committee and will be on the House floor for second readings, hopefully this week, but if not this week, then next week. And then right now, our nonprofit hospitals have to provide community benefits. And that's in exchange for not having to pay any taxes. So a nonprofit hospital doesn't pay federal tax. They don't pay state corporate income tax. They don't pay property tax. They don't pay sales tax. So they avoid a lot of taxes. And in exchange for that, they are supposed to provide us with some benefits, the communities that they operate in. And those benefits in the past have been a little bit, at the direction of the hospital. So one of the hospitals said, well, we let the community use our conference room. And that's not really what is envisioned by this community benefit idea. So we have a bill that is putting some guardrails around these community benefits. It is saying you actually have to talk to your community, whatever your community is, and then you have to do what they're asking for. And the reason that I'm interested in the bill is because a lot of what we hear the communities are asking for is more behavioral health resources. They want the hospitals to provide more behavioral health care. And that is in alignment with what I would like them to do also. And they're not doing that. And they're not doing it at the rate that it's being asked for. So we're asking them to align those things, to say, if your community is telling you they want you to spend 50% of your money on behavioral health, then spend 50% of these behavioral health, these community benefit dollars on behavioral health. So that actually has met with quite a lot of resistance from the hospitals, but we have been working really hard to get the language right and put it in a good form for them to be willing to do it and to make it effective and all of that. So those are some of the healthcare things that I've been focusing on. I've also, been working on other things. We're about to introduce an insurer of last resort bill, which will be so that people who live in high wildfire risk areas who are starting to be told they can't get their insurance renewed, they will set up a system where the state provides an insurer of last resort so everybody can get insurance, and that's about to be introduced. And then we also have a bill about underinsurance, which I'm on with Rep. Brown, and so that's through the House and on its way to the Senate, and I think that will get passed. And then I'm also on a bill with, two bills with Rep. McCormick, and one of them is about using biochar to plug wells because it has this ability to really do a good job of plugging wells and not cracking and leaking like cement, but also it has potential other benefits in terms of carbon capture. And she and I also ran a bill that is about allowing counties to regulate shooting on private property in neighborhoods where that isn't safe because it's too dense. And then, of course, the other thing that the whole legislature has been working on, and that I ran a bill, my bill was about the 3-day waiting periods to purchase a firearm. And that's a suicide prevention measure. So now it has passed the House and the Senate, but there's an amendment. So we have one more step to reconcile the House and the Senate, and then it'll be on its way to the governor. And then I guess the last thing, this is the first bill of the year of mine that got signed into law. And that is a bill that allows psychologists who have a PhD and also go back to school and get a master's in psychopharmacology, and then spend some years training under a licensed prescriber. They can prescribe psychiatric medication. So it's expanding our network of prescribers. So that's my spiel. And I would love to take some questions if anybody has any.
Thank you, Representative Amabile. I wonder if you could comment on the intersectionality of gun violence prevention bills and healthcare. If you could talk about that. Yeah.
Well, I mean, clearly it's a public safety problem that we have so many guns and so much gun violence. Tomorrow I'm going to run in a budget amendment. Well, it's an amendment to one of the budget bills, an orbital bill that is going to give $1 million to this Office of School Safety. And it's specifically about prevention of teen gun violence. And so what are the ways that we can help teens deal with whatever anxiety and anger and things like that that they have, and channel that in some different way other than gun violence. But obviously it's not just teens, it's our entire society is turning to violence instead of some other ways of communicating. And, we have just the temperature is so high and everybody is so on edge. I don't know. It isn't just gun violence. Like I have gotten people road raging around me more times in the last 2 years than ever in my whole life. Maybe it's because I'm a terrible driver, but I don't think that's it.
I doubt that.
I don't know. Does that answer your question? I mean, obviously, gun violence is a public health issue that we really have to deal with in a public health response.
Well, I was thinking specifically about the bill that I believe has passed or is on its way to passing about a waiting period before you can, you can purchase a gun and actually pick it up.
Yeah.
That it will prevent suicides. I mean, that's a healthcare bill.
It's totally a healthcare bill. And that was my interest in running it. It's not just suicide, though. It is also homicide and domestic violence. So there's a lot of good evidence that says people who get in a rage about something will go and buy a gun and then use it without having any kind of cooling off period. And of course, I had my own experience with my son who wanted to buy a gun so he could kill himself. And we found out about it. So we went down to the gun shop and he had filled out the paperwork for a background check. He had chosen the gun that he was going to buy. And luckily for all of us, his background check didn't come back instantly. And we were able to persuade the gun store owner not to sell the gun. And then, a day or two later, my son was actually in the hospital. So, but had his background check come back instantly, I think he would be dead now. So that was my interest in that particular piece of legislation.
Well, I'd like to thank you for running that bill. And I believe that bill and the other gun violence prevention bills that are going through the legislature will save lives. Every one of them will save lives. I mean, they're not just stupid culture war bills. They are going to be effective bills that will save people's lives. So thank you so much for running those.
Yeah, well, thank you. And yeah, I think you're right. They're not just culture wars bills. They are meaningful, life-saving legislation.
Definitely. Virginia, do you know how much more time we have here?
Well, we have all the time we want. Senator Hawkes Lewis had to leave. She has another call at her appointed time to speak, and she didn't realize that. There was a little snafu on changing the schedule of our speakers. I changed the lineup like 3 different times, I think. So it's a casualty of trying to accommodate everybody's schedules and stuff. So we have a few more minutes for questions and answers for Representative Amabile.
Because I had a question. I also had a comment. Earlier, you were saying that Rep Brown was a hard act to follow, but you had logged in after I had done an intro. And one of the things I mentioned is that our district attorney, Michael Doherty, calls you a force of nature. I don't know if you know that, but so that's pretty. And the other thing I'm struck by as you're talking about your bills is the humanity in every single bill you talk about, which I'm very moved by, and it's just so powerful. The other thing is you made some remarks on the floor one time about how you had spoken to your Republican colleagues about, they're always about mental health. This is what they say. And you were explaining that I believe it was the waiting period bill where you said this is a mental health. We can do both mental health and safety measures with guns. And so I was really struck by that. Can you speak a little bit to that as well? That
Sure.
we can do both?
Yeah, I mean, that is a kind of a Republican talking point is, oh no, it's not about the guns, it's about the mental health. And of course, I think it's about the guns, but I do also think it's about mental health. I think it should be like right now, you can get a gun in a half an hour, but it'll take you about 60 to 90 days to get an appointment with a psychiatrist. And we have to flip that equation. It should be easier to get in to see a mental health care provider than it is to go purchase a weapon. And that's what I'm intent upon doing. I think maybe the bill we were talking about was actually the ERPO expansion. And that really is literally like, if somebody is in a mental health crisis, let us go and remove their guns. And that to me is the perfect example of how somebody has shown that they're having a mental health crisis. And so let's not give them the tools to go out and do something terrible, either to themselves or to somebody else. And that the Republicans can't put those things together, can't kind of put aside the culture war and just say, yeah, you're right, that's a good idea. We should definitely do that. And certainly some of them can. Tony Spurlock was the champion of the first ERPO bill. And that was because he had, I think he lost his son in a terrible thing where they knew the person had guns and was having a mental health crisis, and they couldn't do anything about it. And so he became a real champion for that first 2019 ERPO bill. And I think expanding it is absolutely the right thing to be doing.
I thought of just one other question, and that was, as you're coming up with these bills that of course are, going very deep into how inhumane some of these practices are in jails and stuff. Do you ever get pushback from people who say, well, then they have to really answer the question of what are our jails for? And I noticed that every time you talked about another bill, you said, by treating them so inhumanely, you're not helping them, you're making them worse. And you were talking about recidivism. So do you get pushback? Like the jails are about punishment. Why, you're making it easy on them or something like that, ridiculous like that. So can you speak to that?
Yeah, we get a lot of the bill about the 4-point restraints. First, the Department of Corrections put a $20 million fiscal note on it. And we were asking them to do less of it. And they were saying, well, you're also asking us to go and check on these people and make sure they're okay. And that's going to cost us $20 million. And that's just, it's absurd. That just says we don't want to do it. We don't want to check on people, and we don't want to stop doing what we're doing, because that's the easiest way we have of dealing with people who are a danger to themselves. And they are. There's no doubt, like we heard just horrible stories of people, ripping out their own intestines. So yes, they have to have some tools for managing people who are in a mental health crisis, but putting somebody on a restraint bed for days on end, that's not the answer.
You said 35 days for that one case.
Yes, one person. Yeah. And that's just, and the idea that you don't want to go and check on them every 15 minutes and make sure they're okay, that's That's not okay. What we wanted them to do was to mirror what they do at the state hospital, where they do use 4-point restraints, but they use soft restraints. They don't use metal restraints, and they don't do that for more than 4 hours at a time. And they do go and check on somebody every 15 minutes when they're doing that. So we wanted them to do what they're doing at our state hospital. And I don't, we obviously weren't going to get the bill through with a $20 million fiscal note, but we've been working, compromising, working with DOC. And I think we're going to ask that they get an accreditation that would make them adhere to the policy that our state hospital does. And we're going to give them 4 years to do it. And that's kind of the compromise that we reached.
It looks like
But-
Kathy Partridge has the next question, but go ahead and finish. I'm sorry about that. Yeah.
No.
Okay. Hi, everybody. I hope you can hear me. I don't have my regular microphone, but Rep. Amabile, I'd like to start by applauding the work you do for mental health response, for access to treatment, and for so many important aspects of behavioral health care. We've talked before, and you know how much I stand with you on the work that you do, and we've made so many changes, and thank you so much. But this evening, I just had to speak up because I'm so fearful about the current cultural attacks on gender nonconforming and trans persons, and even the art of drag performance is happening in our community right now with this thing about the safe to tell calls, about the Christian schools. I mean, all of this. Right now I'm being trolled on Facebook for my support of the trans community. It matters a lot to me, and I just want to support you and ask that you do what you can to stand up for the LGBTQ plus community against these attacks.
Yeah, well, thank you for that. I want you to know that you have an incredible champion in Rep. McCormick, who ran one of the 3 repo rights bills and has personal experience and has a deep understanding of what it means to have a trans child and what it means to be trans, and what we're up against. It is incredible, the vitriol that's being directed at people. And you do have to wonder, like, wow, what are people so afraid of? So yeah, I will do everything in my power, and I will be supportive of everything that Rep. McCormick is doing. And you're right that
Thank
is
you.
a huge issue.
Ray Rodriguez has his hand up.
Hi, yeah, I wanted to echo what Kathy was mentioning about the attacks on the LGBTQ community, especially the trans community, and the female impersonators. A lot of people need to be reminded that our founding forefathers wore makeup, tights, and wigs. So, and my serious question though is that regarding the restraints that you're the bill that you're doing on restraints, I was curious if that is going to apply those rules. Are they going to apply to public as well as private prisons?
Yeah, they would be for all the prisons that are under
great.
DOC's control, but they only use them in some of the prisons. So where they have people with serious mental illness, and Denver Women's, they use it there. But it wouldn't apply to jails. But jails I don't think there's a lot of evidence that jails are doing that. They do other things that are terrible, like they put people in restraint chairs in Boulder County Jail. They've had a young man, they've done this multiple times, where somebody's in a restraint chair and then they tase them while they're strapped to this chair. And that's just not unusual. I didn't know that it was normal that they tase people in jail, but that is actually a common practice. But having somebody strapped to a restraint chair and then tasing them is really, really beyond the pale, but it does happen. That's another thing that we're working on is we put together last year this jail standards commission to get at what are the acceptable practices in jails. And that commission has been working away all year, and in next session, we'll introduce some bills around what are minimum standards that Colorado jails should adhere to.
And out of curiosity, I love that there's standards and there's people that are advocating for people that are incarcerated. Out of curiosity, what is the chain of command when a family member hears these horror stories about their loved one and these things are happening to them? Because there's this power structure and there's power hierarchy that they are living under that none of us understand, right? So when we hear these things and they tell us on the phone when they call us for their visits, who do we go to when they're breaking their own rules, you know?
Okay, well, that's such a great question. We spent a lot of time on that question today and yesterday, because we're trying to set up a oversight, but it's hard because every jail is operated by a sheriff, and they don't have any, there is no oversight. DOC is at least part of the state, and there is some oversight into that, but each jail is its own thing. And they get their funding from the county, but they operate completely independently through their elected sheriff. So we're hoping to set up like a complaint mechanism so that somebody who's in jail, who doesn't feel like that jail is adhering to the standards, has a place to go to report that. And
Thank you.
that's to be done. That's work that we still need to do.
Thank you.
Thank you so much, Rep. Amabile. I'm not seeing any more. Did you see some of the comments in the chat?
Yeah,
Lots of people really happy with the work that you're doing.
thank you.
Thank you very much. And I'm sure you've had a long day today. Is there anything else you wanted to talk about, or?
Well, I think it looks like we have one more question from
Oh.
Beth or Stan.
Yeah, thanks, Rep.
we go.
Amabile. I'm going to jump back just a little bit to, you talked about a bill that would enable, with proper training, psychologists to prescribe psych meds. And it seems to me like that's a very positive move, because psychiatrists don't have the time to relate to clients that psychologists do.
Yeah.
And I'm wondering if medications were prescribed by a psychologist who has a better relationship, if the patients would have a better track record of staying on their medications because they have a relationship.
Yeah, well, I think you're right. And that was a lot of why I was interested in the bill. So it does three things. It provides expanded access to care because there's more providers. It provides less expensive care because you only need to go to one provider and not two. But I also think we will see that it provides higher quality care for some people. So you'll go to that provider, you'll get talk therapy and then medication management with them, and they'll see you on a much more regular basis than a psychiatrist. They'll know you better. They'll have eyes on you. They'll be able to tell if you're having side effects that maybe you can't even report. And, things like tardive dyskinesis, you might not even notice you're doing it, but your provider might see that. And so I think there's a lot of benefits, and that's why I was really excited about it. And the governor's office was also very enthusiastic and supportive of the legislation. And I think that's part of why we got it through so fast and got it signed into law so early in the session.
Marta, do you want to go ahead and ask your question?
Yes, Judy, thank you for doing what you're doing. I work with a lot of Hispanic, some in jail, some in DOC, and I hear what goes on or whatever. What can we do on their behalf? A complaint to whom? Here at the sheriff's in Boulder County is Curtis Johnson. So that means we got to go after Curtis Johnson, and can we do as outsiders? I mean, you're doing all the work with the bill, but what as a community are we able to do to support you and help you?
Yeah. Well, okay. So, if you have issues with what's happening at the jail, yes, you should write to Curtis Johnson, but also to the county commissioners. And I think like Ashley Stoltzman is going to be a champion. And not to say that, and Marta too, obviously. And so let them know, because they don't know what's happening in the jails. They're hearing, you know, from Curtis or whoever, yeah, things are good, good, good. But they don't hear, if they don't hear from you all, they don't know. So I would say it's very good to write to them. If somebody's in DOC, you know, I would write to the governor's office and say, my person isn't getting good treatment in DOC. But I would also write to DOC. They have, their ledge liaison has been fantastic to work with. And so I think they're, you know, they're in defensive because they're getting attacked all the time, and they're getting attacked all the time because they're really not doing a good job. And that may or may not be their fault. I mean, they're underfunded. They're, you know, we keep making more things a felony and sending more people to DOC. So they've got more and more people that they're supposed to care for, and they don't have, they're asking for more beds. They want to expand. They can't close those private prisons because they need the beds. And we keep adding more crimes that are going to result in more people going to DOC. And I'm not sure that's the right, I'm not sure that's the right trajectory. I think we need to we need to be spending our money on the social determinants of crime. We need to be stopping crime before it happens.
Mhm.
But it's really hard to get, people to do that.
Thank you.
And you can write to me and we'll help direct your complaints. And it is sometimes helpful, not to brag, but like, it's different if you write to Curtis Johnson than if I forward your email to Curtis Johnson and say, hey, what are you doing about this? Not guaranteed to have any effect, but it does sometimes get a little more attention.
Well,
And I'm
oh,
always happy to
Right.
do that.
great, thank you. No, it does help because in order to do a miracle, actions has to happen, and we cannot just talk and complain and don't take action. We need to. Our voices need to be heard. Yeah.
Yep.
Thank
Thank
you.
you, Marta.
Well, thank you guys for having me, and I'm sorry I was late and I had to go after Kyle.
Hey, no, we just rolled with it. And this time of year, with this part of session, and it's only just going to get more crazy. We're used to kind of flipping things around and doing it because we so appreciate you coming and speaking with us. It's a really good opportunity for people to see all the amazing work you guys are doing. And, you know, I just thought of something else to tell the attendees. Is, people earlier, someone was asking about bill numbers. And the thing is that you can actually look up all these bills by the legislator name. So in other words, if you go to ledge.colorado.gov, we'll put that link in the chat, and go under the legislators tab. Like for instance, if you typed in Judy Amabile, then you get her page with her contact information. And when you scroll down, then all of your bills are listed at the bottom of that page by year. So, you know, you can look at it, it'll have the present year up first, and then you can, and you've been there since what year now?
I started in 21.
21, that's right. That's right. Okay. And you can see just all the behavioral health, the jail standards bills. It's just pretty incredible. So thank you, Rep. Amabile. Thank you so much for being here after such a long day, I'm sure.
Yeah, well, thank you guys for having me, and thank you for all the good advocacy work you all are doing. We really appreciate it.
Hey, easy to advocate for you guys. So thank you.
Thank you,
Thanks.
Rep. Amabile.
Bye.
Wonderful.